Thank you so much, Federica. First of all, I would like to thank UNFPA, Federica, GPL team, Rochak, Sushmita to organize this platform. I think it is wonderful. And I'm quite excited that, that now we have an international audience to all the interventions, we have been toiling with for past so many years. And it has been very, very difficult for us to really conceptualize, implement it in such a labor intensive industry like apparel. So you can imagine Shahi with a complete employee strength of more than 113,000 plus people, working for the organization. How complex this can be to implement the programs, and it has been a mystery all around, what happens after all these interventions. So for us in Shahi also, we could assess a lot of results, but after we partnered with GBL, it was, a great learning curve for Shahi also as a business partner, that these interventions can be evaluated so well. And we can actually see a complete business outcome, which can impact the bottom line of businesses. Just like to, quickly walk you through some key interventions, what we have been implementing at Shahi, and how did we partnered with GBL to when we created this return on investment tool, and what all challenges we felt, and how it can really impact the manufacturing setups, and especially the labor intensive ones. It can be applicable to anywhere. So quickly, I would like to share with you that out of 113,000 employees, more than 70% are women. For all these years, we have been investing in a lot of programs to support better health and well-being initiatives for all our employees to improve their overall well-being and indirectly their quality of work also as well. When we partnered with GBL, we were, quite supported by the randomized controlled trials, which is a very strong research tool which GBL brought in. We have applied these tools into all our interventions which have social and business impacts. And then we try to do a lot of research. We try to understand how these programs can benefit similar labor-intensive industries and other manufacturing industries as well, and to encourage them to invest in their workers' health and well-being. And we also ensured that these interventions programs, which are supporting the workers' health and their work well-being, are scalable to a very large number of setups also as well. So the first intervention program which I would like to touch upon is the sexual and reproductive health. We did a lot of research in our migrant workers. Then we found, most of these workers and working associates, and more than 70% of who are women, they are actually, I would say, ignorant about various aspects of family planning, safe supports, reproductive health education. Plus, we also found that there is a huge and numerous taboos around discussing all these topics like family planning in various households and plenty of communities in India. So that is where we started with this program, Sexual and Reproductive Health Program. We then partnered with the Family Planning Association of India, and this is the program we are ready to launch this year. Second program is a very interesting program. We call it an Iron Woman program. The reason is that when we delved into this particular topic, we found out that India has the largest number of anemic women in the world. And more than half of this complete population is, these women are of reproductive age, and these are anemic. And being anemic is painful. It is not easy. It really impacts a complete agility, There is a problem with the mental health also. It creates pain, and the patients, they are actually in the constant discomfort. And anemia can also result into a lot of serious productivity loss in the manufacturing units, because imagine the women suffering from anemia and they're actually moving and walking with all these ailments. So it impacts our productivity, quality to a very large scale. Then we came out with this program known as Iron Women, in which we tested the blood hemoglobin levels for approximately 20,000 women across our 25 factories, after we partnered with ESI in India. And then we found that 29% of the women were anemic. And then we supplied all these women with free iron supplementation, with the support of ESI. And then now in our rural factories, we are, testing. We have tested again more than 13,000 women in the terms of hemoglobin. So this has been one of the, engaging programs for us, and which has brought in a huge learnings. And then another program I would like to specify is Menstrual Hygiene Management Program. And this also was a very, very huge learning to us when we did our research. How much ignorance is still there across the community in the terms of menstrual hygiene. And it is then we launched this project known as Prava, which is core to women's health. And here we try to educate women over various aspects of menstrual hygiene, its management. And also we installed automated machines, which can be accessed by the workers. And these sanitary napkins are provided at an extremely low cost. And these are very high quality sanitary products. And these vending machines are very easy to operate. And practically all these operators, all the women associates, they can actually access these vending machines. And just to share with you, 1,000 female garment workers were trained upon the menstrual hygiene piece. And since past 2 years, 38,000 sanitary napkins has been used by the women. And believe me, out of this complete strength, earlier, hardly anybody would use a proper high quality sanitary napkin. And earlier they were using all kind of, homemade solutions to manage and to deal with the menstrual related problems. Now we are working upon to take it to the next levels. Now we are actually trying to scale it up to rest of our factories. This also has been a very, very breakthrough product. And after intervention and after the GBL researched, we could see a lot of business benefits, which I would be sharing in a short while. After we were working with GBL, when we are developing these tools, we had to experiment on lots and lots of angles, because apparel as an industry, it's a very complex industry. It's labor intensive. Imagine approximately 5,000-6,000 people working under the same roof, and imagine the kind of data which comes out. And here we are trying to implement a project which is supporting the women on their health, on their well-being. So it becomes very, very difficult to really separate the outcome. We just can't say that, it is coming out of, maybe if there is a productivity hike up, there is an improvement in the productivity. It becomes very difficult how this productivity improvement is coming from. So it is difficult to isolate this impact of an intervention or productivity, because there are many, many factors on a day-to-day basis influencing productivity. The way we operate is we have got assembly lines. So if there is a crisis in the complete manufacturing unit, so plenty of times, workers, they may have to shift from one line to another. And this spoils the complete dynamic of, the complete formula of how do you create an efficiency, because number of people is very, very critical, very important to calculate the efficiency overall. So this disturbs the complete dynamic. Then we suggested that GBL look at more tangible data points. Like instead of looking at the productivity, efficiency, which is complex, then we suggested that GBL looks at more tangible data, which can be, studied much easier, much easily, like absenteeism, turnover. These are easy to track. And through the worker well-being initiatives and the health improvement initiatives, these aspects can be improved to a very, very large level, because workers' health is a very, very critical and important element of, because of which, workers are forced to take a day off. Maybe their health, maybe their children's health, these are very, very important. And imagine if few of the workers, they take a leaves, so the machines on which they are working, they become vacant. And if the machines are vacant, that means we don't produce and we lose business over this. So I have seen plenty of situation in which there is only 80% occupancy in the factory. Imagine 20% people are away, so that means we are not producing in 20% of the machines. So if by the interventions like these, if we can support the health of these workforce, and still we are able to bring in that 10% people, imagine the kind of support we give to the complete manufacturing setup. So these are the angles. For many years, businesses have been quite busy to look at these finer points. And this is business. This is pure money. There's worker well-being, but indirectly, the business organizations, they are creating money, and this impacts the bottom line like anything. It has a great impact over the complete bottom line. Another example I would like to give you is, say, menstrual hygiene management. We have observed in our medical rooms also plenty of women in our workforce. They struggle with a lot of health issues during their menstrual time, and in plenty of women it's a painful process also. And our medical rooms, they are normally occupied with the women undergoing such a stage, and plenty of women are actually embarrassed to maybe even share that what is that they are going through, right? Even talking about topic like menstrual hygiene, it is also a taboo in various communities. So these women, they suffer very, very silently. So when we rendered this kind of a support, this had a huge impact over the complete absenteeism of these women. Plenty of women, they even try to take a half day off, in case they are going through the menstrual periods. In a nutshell, what I'm trying to share with you is aspects like absenteeism and attrition. These are very, very important aspects for a manufacturing setup. If this can be controlled in a labor-intensive factories, it can have a huge return on investment. And this is something which this tool, ROIT, is trying to capture. And the biggest thing is, when we start to give support to the workforce, there is a huge word of mouth to our factories, and plenty of new people who want to join a workforce. They try to come into the industry, they try to join our factories. That is additional benefit which these interventions, with supports of worker well-being, health, this actually bring in. So these labor-intensive industry like apparel, that's somewhere in the middle of being organized and unorganized both. So it is not too organized, it's not too unorganized also. So it is somewhere in the middle. So there can be a lot, and there is a lot to be done for the worker well-being, especially with the female workforce coming from a lower income backgrounds. Until now, businesses has not done enough, or interventions, programs, investments for improving the health of the workforce. Operations, manufacturing, they have been spending millions of dollars in improving operations, productivity, machines, technology. But this is a new way to think about it. In case, and this investment is, it is worthwhile. So this is a new way to look at it. We now feel should be a part of the core business strategy, which has a direct impact over the bottom lines of the company and the profitabilities of the companies also. Another example, very interesting example I would like to share with you is, we also have recently started to study the eye health of people, of the workforce. Nobody could ever imagine it. So we started to, get the eyes checked up of female workforce. Imagine one thing nobody thought of. When the workers and the quality checkers who actually check the quality, in case they have a bad eyesight, imagine what kind of a product they can pass, sent to the final stage. So the products, they go to the final stage, and after that they come back for a rework just because of a poor eyesight. And there are plenty of women, they're absolutely ignorant about their eyesight. So when they produce, when they stitch the garments, imagine how big risk the industry runs on that, a low quality product can be produced because of a bad eyesight. So imagine what kind of a business impact these interventions can be, so which has a direct impact over the complete businesses. So this is an amazing beginning, and I think the complete community and the complete manufacturers, labor intensive industries, they must look at this angle. And I think the return on investment tool will also validate the viability of investing into these interventions. Correct. And I think United Nations Population Fund, I think it's a great initiative they have taken so as to empower the industries all across and help them out to really invest in these interventions and evaluate the overall impact also. I think this is a good beginning.